I am Emmanuel Margao, a trained and qualified nurse anesthetist, RN. Most of my work entails a lot because I have to see the patients, especially the surgical patients. I have to see them, and most times I have to see patients also in emergencies. Most times they require intubation, but it's very hard to intubate here because most of the patients that we got, I have to face a whole lot of problems. And most times I have to give spinal because there is no alternative. Most times the patient needs, the doctor needs, what the doctor require from the anesthetist is to relax this patient, make the patient rest, and that the patient cannot feel no pain during the surgery. But I have no alternative. I'm strongly most times being restricted. I cannot do otherwise because there are no machines. I've been trained in that. I think if I have that opportunity, I can do my best. But the machines are not there. So most times in working in a hospital setting like this, where there are limited resources, the monitor is broken, and most times I have to take the patient's vitals with the sphygmomanometer, which I have to do manually in the time. So most times patients are not fully relaxed, because most times we have patients, we don't want to refer these patients because now we have surgeon, a trained and qualified surgeon in the hospital. Now I'm back to pick up this job. I'm there to play the role of an anesthetist. I'm there, the know-how is there, but the requisite instruments are not, the equipment that to work with is not there. So most times it's appalling because what I require to work are not there. But we want to do the work. We want to save lives. We want to save more the lives of children and the maternal women, pregnant women. But these facilities are not there. So what happened most times? You see, if you can check our record, we do more of spinal, subarachnoid block, and this most times. You see, there are surgeries that requires intubation, but we don't have that. So we are being restricted in that. And most times in patients that come for emergencies, you have to, that have airway problems, you have to intubate those ones with extreme cases, which the doctor will say, oh, yeah, we wish we have something to intubate. I will intubate them, but you have to go manually. It's a hell of job. So I have to do it manually. If that's require 5. I can vividly remember at one time we were having one case that the patient was having severe respiratory tract infection, and then so the saturation was there and there was no other way I can do. I have to intubate and do manual. And like we likely say yesterday, the staffs are limited, nurses are limited. So what I do most, I have to overstretch myself. I have to stay on duty. I have to stay there till 1, 2 o'clock tonight. That night before I went home for a bit of rest, and they called me back. Hey, no, the saturation is getting down. The nurses come, so I had to come back and then give some drugs, and then start ventilating. So that you can imagine, if you can ventilate for 4 or 5 hours, you ventilate a patient just to improve the saturation of that patient. So it's a hell working here. But I will appreciate very much if Mission of Hope can make it possible for us to get like a UAM machine. And I say specifically UAM machine because I have been trained in that area by Johns Hopkins University, and I have qualifications to that. I think I can do my level best in the usage of that type of machine. Few things there are few qualities that make UAM machine very much unique. It is a tropicalized machine, and that one you can use it. So most times here we are being faced with problems of power outage. So most times we'll be working and then the electricity just went off. So when it went off with UAM, automatically that can change to room air. And so you can relax, the anesthetist can relax and use it. You can use the room air to ventilate this patient with the aid. So most times, and also, it's very easy to get the material, like halothane is easier to get a bit here as compared to other gases. So you see, so with all those stops, and I will appreciate it very much. And if that kind of facility, we can able to get that kind of facility, we continue to pray for Mission of Hope that they too will get other and benevolent spirits, that we people that we offer help to them, so that that help also in turn will be showered down to us here, because we need it desperately to save the lives of these children.